much. It's really, we really appreciate having you all with us. And we are excited to be sharing with you this afternoon Zoom. This is the third in a series that we've done, and we've really been pretty gratified at the feedback we've been getting. And today, we have a special Zoom-in briefing talking about the work that JSSA has been doing with our mental health programs during COVID and beyond. So I am very grateful for so many of our longtime supporters, particularly our High Society members and our board and Ambassadors Council that have joined us today. So we are going to be muting you and hiding your beautiful faces for a little while and focusing on our two speakers, Todd Schenk, our CEO, and our Senior Director of Mental Health Programs, Joseph Wilson. And we also have our COO, for those of you who have not met her, who joined us during the time of COVID and has quickly become indispensable, who is Kylie McLeaf, who is also on the call with us today. So thank you all, and Todd, your turn.
Well, thanks, Deborah. Appreciate it, and appreciate all of you joining us. It's nice to have the chance to be able to give you a little bit of a in-depth look at what we've been doing on the mental health side in the community. And just so you understand kind of the frame of this, I'll kind of give the treetops view of some of our work and why, you know, how we're seeing emerging issues related to mental health and what our response is taking into consideration. And then Joe will talk at a little more granular level about what it is that we're doing, what it looks like, what we've seen, give you a little sense of what that work is. But we also want to leave a decent amount of time at the end to allow for some questions and some back and forth exchange with all of you. So, you know, it's hard to believe we are at this point about 8 months into the pandemic and the significant impact that has had in our area. And I do feel it's important to just take a step back quickly and remind you of kind of our initial response, which is that, you know, at the time that, you know, most offices were closing and people were really moving to shelter in place, that had an impact across all of our services, but in very different ways. We had some of our services like hospice and home care and our meal delivery that we continued to deliver in person, largely uninterrupted. And that continues to this day. Other kinds of services, like mental health, that we'll talk more about, really needed to adjust and determine how to continue to provide service when in-person was no longer available. And we'll give you a better sense of what that's looked like in our mental health services, but in our disability work, in our services with older adults and care management, it really has been pivoting to more of a virtual platform. Not necessarily Zoom per se, but Zoom-like kinds of sessions or some distance work out in the community. So, I want to talk more about the mental health side and what we've been seeing so far as the impact of this crisis. As I'm sure many of you could imagine, this crisis has had a significant impact on many people across the community. And I think it's important to remember that, you know, although the larger issue that we're talking about is a health-related pandemic, that it's not, that people's kind of difficulties or challenges have not been limited to the health component of this pandemic. There's also been a significant economic impact of this pandemic upon many people, including just uncertainty about income, about job security, etc. There's an impact in terms of being isolated from family and friends and what that does to our social networks and our usual areas of support. We also are living at a point where there are multiple other pretty large societal issues that we're facing. So the prominence of racial justice issues in society and how this has been stirring up feelings for many of us, as well as a lot of anxiety about probably the most contentious election that we've faced in a generation. All of those factors are kind of colliding at the same time to have an impact on people's emotional health. So, one thing that we have looked at in trying to see how best to respond at this time is what is there to learn from other kinds of crises that society has been through. And so we look at examples like 9/11, like Hurricane Katrina or Sandy, like other kinds of disruption within communities, and understand that in addition to the acute reaction that people have at a time of crisis, there's also the threat of a much longer term impact on people's lives, where you might see the emergence later of the impact of the trauma that people experience. So not everybody even recognizes in the moment the difficulties that they might be having. They're just kind of one foot in front of the other and trying to make the best of it and keep things on an even keel. And then when some of the crisis does finally recede, some of the issues that people have been facing, a high level of anxiety that they've come to tolerate, then it becomes evident to them that this really was not so functional and that they're having a tough time reacclimating. So we've recognized that our approach really needs to be at least twofold. One is to be available and make our services accessible to the people who are having current acute difficulties. There are definitely people that are experiencing grief from the loss of somebody close to them, the effect of losing a job, the experience of isolation or difficulties with educating children in a virtual environment, or not being able to visit a relative because they're concerned about that person's health. And sometimes that's causing real acute stress or anxiety or depression. And so we need to be available to respond in the moment to those issues. The other dimension is to make sure that we don't lose sight of the fact that there's a lot that's being stirred up right now that we're going to see 6 months and 12 months and 18 months down the road. And so how do we also make sure that our approach is incorporating, it has a preventive dimension to it, so that we can help to intervene, provide some better coping mechanisms for people, and help them forestall the emergence of larger mental health issues in the future. So how are we doing that? At a high level, the first part is making sure that we're serving our existing clientele. And as I mentioned, mental health, like some other parts of the agency, has had to move to a virtual platform. So we have telehealth that's incorporated into our electronic record so that we're connecting with people over video and able to continue to have therapy sessions with them. In some cases, we're using phone calls if somebody can't manage the technology. And in some rare instances, we're still doing in-person work where somebody's symptoms really need to be seen face-to-face. There needs to be an interview face-to-face or testing done face-to-face that you just can't do in the same way virtually. The vast majority of people that we were seeing pre-pandemic, we've been able to continue to provide some service to through this virtual platform. The next dimension is really making our services accessible for those that might not even recognize that they're facing mental health issues. So while those people aren't ready to ask for therapy, they might be willing to connect if there's a support group or an educational program. And this is the more preventive approach. And Joe will speak to these specifics in more detail in just a moment. And third is bringing our services out to people at points where it might be better for them to access our help. So we've done this for a long time. We go to doctors' offices or schools or senior living communities to bring our services on site. In this environment, that may look a little different, looks like a dedicated entry point for a particular agency or an institution. And what's, I think, been interesting to us during this pandemic is there has been tremendous growth in outside organizations or institutions approaching us. Rather than hearing from the individual or the family making the call, we're hearing from the business or the housing community or the school saying, how can we help our employees? How can we help our students? How can we help our congregants? And again, Joe can speak in more detail about where we're partnering to help those organizations and what that's looked like for us. The last dimension I want to just highlight that is somewhat unusual in this crisis is that the impact that's being felt is pervasive, right? We're used to, as an organization, serving individuals who are struggling or in some kind of acute crisis. What we're not always used to is that our own staff and the broad community are living through the same exact crisis in the same kind of way with some of the same struggles. And because of that prevalence and the multiple challenges that we're seeing, we've had to provide more support than ever to our own staff. So we're delivering support groups internally. We're sending wellness packages to our staff. We're making sure that we're adding flexibility to their jobs because of the other demands that they have. And in some cases, providing therapy for people individually in order to help them through these kinds of struggles. Kind of like when you go up in the airplane and they remind you, put on your oxygen mask before trying to help somebody else. That certainly is the approach we've taken with our own staff. Unless they have their oxygen mask on, they're not going to be much help to the rest of the community. So I'll turn it over to Joe in a moment to build on some of these points and give you more of an on-the-ground flavor for the work. But I also want to take a moment to just acknowledge some of the challenges that we also are facing in mental health service delivery. A lot of areas where I'm really proud and think that we've had a lot of success, but that doesn't negate the fact that there are day-to-day challenges here. Funding, of course, is always a challenge in mental health service delivery. Insurance companies, government tend to undervalue our services, and so reimbursement doesn't always keep up with what the true cost of service is. However, in these times, there are even new issues about how services are supported and the ways that we need to deliver them. So moving to a virtual platform sounds great, but there was a time that insurance companies and government was not allowing us to get reimbursed for that. So there's had to be really significant flexibility from government and insurance companies to allow services to be delivered in this more flexible way. But that flexibility is time limited, and it's only given to us for a few months at a time, with the threat that that could be taken back and that our ability to get reimbursed for telehealth work in the way we're doing it could be pulled, and we'd be forced, in order to get reimbursed, to deliver services out of our office locations. That would dramatically impact our ability to serve the community, of course. People are hesitant to go out of their houses into public settings, and for our own staff, it would be a struggle to get them into our offices in the same kind of real estate that we had before, and to be able to keep offices safe and social distanced and cleaning between appointments. So that's something that we've been looking at, planning for, trying to figure out in limited ways, how do we test what it would be like to be delivering services back in an office setting. But we're still hopeful that while it is not fully safe to go and congregate in office locations like that, that this flexibility from government will continue. The other kind of funding challenge is on the support group or the educational programming end that you'll hear some more about. And those kinds of services really aren't funded at all by government or by insurance companies. You know, it's not somebody's not working from a diagnosis, it's really intervening earlier than that. And yet we found that those avenues are really critical in reaching people that might not even realize how they need help at that point. So the philanthropic support from many of you has really been instrumental in allowing us to respond to the needs as they emerge, rather than being beholden to those funding sources to dictate how it is that we deliver service. So when sister agencies had to furlough or lay off workers, we were able to then provide free assistance to some of those impacted staff and not have to wait for some other funder to come along or government to catch up with how to support dislocated workers. When government insurance companies might prematurely halt flexibility of telehealth, we will still be able to continue to serve people virtually if that's what they need, because of the support that we enjoy from philanthropy and donations from so many of you. We're really blessed to have all of your support and your interest in tuning in and wanting to learn more about this and keeping JSSA operating from a position of strength. I'd like now to introduce you to Joe Wilson. Joe is our Senior Director of Mental Health. He's a licensed clinical social worker, so he comes at this work from delivering service himself for many years and being quite a skilled clinician in his own right. He's been with JSSA now for about 4 years, and he has strengthened our mental health department immeasurably, not just through his administrative oversight, but also through his clinical strength, where we've really crafted new and innovative approaches to service. We've been able to implement service based on what's known to be most effective practices, and to see the outcomes of our work demonstrate increased positive impact on those we serve. So Joe, take it away.
Thank you, Todd. Well, that was an unexpected introduction. I'll make sure to put all that in my evaluation for this year. Welcome, everybody, and thank you so much for the opportunity to speak with you today about mental health services at JSSA. I'm always excited to talk about the need for mental health services and how we can develop them to promote the wellness of our community. And so I'm enthusiastically hopeful that this time, although it's a crisis, is also an opportunity, because certainly a lot more people are paying more attention to what mental health is and how to best address mental health needs. And I think that's probably the best way to encapsulate where we are currently at JSSA in terms of taking advantage of this crisis and opportunity moment to advance mental health care, which is a real challenge, as Todd has shared for all the reasons he stated. But what we hope to do, and I think what I'll hopefully share with you today, is some of the innovative approaches that JSSA is taking to advance mental health services in the community. But before I get into those specifics, I just wanted to sort of help folks understand typically what mental health services are, right? Whether you've accessed mental health care before or not, lots of folks do have a challenge to both describe what mental health treatment is and mental health services are, even for those who have been through it before. They're very hard to tell or describe. It's not like we go to our physician and we get a vaccine, or we get prescription medication and we're cured. Mental health has always been a fuzzy concept, and therefore mental health services always a fuzzy concept as well, as far as how does it work. And the one thing that I've worked with folks at JSSA to really define is a characteristic that it really sums up how mental health services works best. Research has indicated over a number of years that there's one significant factor that dictates the success in mental health service delivery. That is to say that people, when they conclude their service, report better outcomes or report feeling better or that their issue's been resolved. And there's one factor that has predictably been able to accurately describe or promote those positive outcomes. And oftentimes when I ask people, we're muted today, I can't hear suggestions of what people would suggest, but some people say, well, it's the education and training of the provider, or it's the setting if they're getting it at a top-notch university versus a community mental health center. Others will say it's the type of practice. Are they using an evidence-based practice? And all of that those are all important things, but they're not nearly as important as this one thing. And the one thing is connection. Connection between the individual seeking service and the individual providing the service. The number one best predictor of success in mental health treatment is the connection. And so at JSSA, we really work hard to focus on understanding how to promote that idea and that concept of connection at every level of service delivery that we can. And what I mean by that is not just that we want the clinicians to practice person-centered approach and really be able to engage and connect with the individual sitting in their office, but how we design and implement programs in the community that promote connectedness to and value of and for mental health services. And as Todd mentioned, what's resulted from that effort has been we've been able to advance our partnerships and the number of partnerships we've had in the community thanks to connecting with individuals and organizations that see the value of mental health services for the people that they serve. So as Todd mentioned, pediatric practices or senior living communities and schools, faith-based communities, wherever we are able to partner, we have first become a partner of choice, which has been terrific in that we get referrals. So people will say, oh yeah, we have this partnership, and we had some pediatric practices talking with us because they heard that we were able to co-locate services. But more than just being a partner of choice, we're partners in valuing mental health services and mental health care. Which is exceedingly rare, unfortunately. Mental health care seems to be still, despite a lot of work we've done in the last 20 years, relegated to emergency or crisis type services. The Community Mental Health Agency, unfortunately, has really all but evaporated from our communities. Particularly in Maryland and even in Virginia, there are very few entities that identify as a community mental health agency, meaning that they're rooted in the community, have community partners, and connect with other agencies and stakeholders in the community to promote mental health. At JSSA, we've been working really hard to serve our communities by being that partner, and I think it's certainly been paying off in terms of the number of connections we've been able to make. In addition to that, that sort of focus on connection with partners, we do focus on connecting with individuals. And part of that means that as we advance the idea or notion of mental health services, that we advance the notion that everyone experiences mental health issues. Everyone. I do, you do, we all have, particularly in this pandemic. And I oftentimes get asked, well, who do you serve? As if we serve, people that, we don't really know who that would be, right? Well, it could be your neighbor, it could be your granddaughter or your niece or your son or your wife or your husband. We serve everybody who understands the value of managing and addressing their mental health needs. Now, some folks are more chronic in their needs and more sustained over time, and others have episodic needs. It's no different than your physical health, frankly. But what we find is that advancing this notion of mental health is everybody's concern and everybody experiences mental health issues, not just helps in terms of the value of our service, but also helps in understanding and reducing that stigma associated with mental health. We've more and more seen in the last 15 years as celebrities and other notable figures have come out to say, I suffer from or I've experienced such, or there's been suicide in my family, that it's becoming more pervasive, as Todd was saying, especially in this pandemic, that everybody understands that when we're cooped up in our home for 7 months and my kids don't go anywhere and don't play with their friends, there's a problem there. We notice that we're getting on each other's nerves more, or we want to stay in our rooms more, and we know the family isn't really coming together as it used to. And when people notice those things, they are noticing their mental health. Their mental health is suffering, and we've certainly seen what I would consider to be a significant increase in the request for mental health services, both from individuals and families. And the latest call data shows that we're probably about 20% above where we were this time last year in terms of requests for mental health services, as well as more partners are asking for us to co-locate those services or to give access to services to particular populations that they serve. And I'll talk a little bit more about that. But it's really important to understand that who we serve is the community at large, and everybody and anybody that understands and experiences these mental health issues or challenges, whether that's increased anxiety or depression. Not surprisingly, those are two of the top 5 diagnoses that we see, or whether it's relational problems or challenges in terms of communication, whether that's couples or families, or very much also developmental challenges for children who are, immature for their age, or not getting along with their peers, or find it difficult to communicate in their family relationships. And so across the board, we see an increase in requests for services. And I think in part, we're benefiting from the idea that everyone now recognizes, although it took a pandemic, unfortunately, to make the point, that mental health issues are just as real as physical health issues and somatic issues, and that they absolutely need to have quality care and service. So at JSSA, what does that service look like? Well, as Todd mentioned, we've moved to a telehealth platform. That is to say that our staff are seeing individuals virtually and working hard to figure out how we maintain a person-centered approach and a focused approach when it comes to providing treatment. When the pandemic first began, we probably saw for about 2 weeks, we saw a complete reduction in service delivery because we had to quickly deploy our telehealth capacity and retrain our staff, and also encourage and invite the individuals receiving services to try this new technology out. For some of them, it was very new. And as Todd mentioned, put resources in place to make sure they could work the technology. And I would say it probably took us about 6 to 8 weeks before we returned to pre-COVID levels of service delivery. And so since that time, we've just seen an increase in the demand for people calling for services. And then we've stepped back and said, well, what else does the community need? We've talked with our community partners to find out what is it that they're seeing and what are the needs that would be best addressed. And what we found out was that really, again, it comes back to the need for connection. There were a number of folks that absolutely needed to connect with others who were experiencing similar challenges, or even just to talk about and understand what was happening in our community at this time. And again, as Todd said, not just the pandemic, which of course was a huge challenge, but also too the everyday challenges that we seem to be able now, unfortunately, to focus more on, since our lives are much more narrower, in terms of the election, the unrest, the social injustice, racial inequality, and the unrest in general has absolutely created challenges for folks in terms of feeling regulated or grounded in their routine or in their life. And so what we did there was, as a result, is we developed something called the virtual community outreach. These are services that we provide that are not paid for by insurance or other sources of funding. This is what JSSA can do to provide that connection to people. We began and have facilitated since we began in about July, and since that time we've facilitated approximately 16 virtual support groups, open to anyone who finds us on the internet or has a web search and says, I'm looking for, they come to our virtual support groups. We've served over 100 individuals since that time in these virtual support groups, and they are around topics such as, how do I maintain my sanity while I'm parenting my 3 children in my home when I can't get a break and they go to school. Uh, we also have support groups that talk about how to understand and manage anxiety or depression in their children. A lot of parents will tell you they know exactly what it looks like when their child has an earache or an upset stomach, but they have no idea what it looks like when their child's experiencing anxiety or depression. They have no idea what it looks like if their child is overly isolating. We often hear parents, wonder aloud, is this just normal teenage thing, or is this actually a problem? And so we're able to provide people with that all important connection to others and to our staff to be able to talk through that and understand, is there a real mental health need? And I'll say oftentimes that's incredibly important, because those experiences allow for them to transition into services that they're able to then, because they've connected with someone who speaks their language or understands the problem in their terms, and doesn't come at them with a lot of clinical jargon or thank you for coming to the office, please fill out this 85-page questionnaire and the doctor will see you. We avoid all of that, and what we find is that individuals that participate in these outreach groups and support groups tend to want to connect with us for services. And frankly, somebody who's ready and willing to engage absolutely produces better outcomes in the service delivery. So we really want that. So it's been really helpful to offer that to the community. As Todd mentioned, we also serve communities of faith. We are in 15 synagogues, or we've been affiliated with 15 synagogues across the Maryland, DC, and Virginia area. And we provide them through our synagogue liaison program. We provide them with access to services such as individual or family consults. We provide a social worker that's essentially on call that can respond to requests for a 30-minute dialogue with an individual or a family. And lately, as Todd also mentioned, a clergy member or someone working in the synagogue who could use some assistance as they're rendering assistance to members of their community. And so we provide this 30-minute consult for individuals to talk about what's concerning them, again, to identify, is there an ongoing need, or is there some way for us to be helpful in a formal treatment way, or do we have some other resources that might be helpful for them as far as addressing the concern that maybe aren't as formal, whether that's connection to a support group, one that we run or that we're aware of is in the community, and connecting them to supports and services. We've also been able to provide parents with support in the home. We're fortunate to have wonderfully trained staff using some evidence-based practices. One such practice is parent-child interactional therapy, PCIT for short. And it's a practice that we use with families that have children ages 2 through 7 that are having extreme difficulty regulating their behavior or their mood. And it's essentially family therapy with coaching. So what happens is, and we're able to do this electronically, we can observe the parent and the child interacting with one another, and the clinician, through a bug in the ear type technology, coaches the parent in terms of how to engage with the child. And so that's been incredibly successful for two reasons. One, it's a very short term, no more than 16 or 18 sessions, and parents can see progress almost immediately from the time they begin, being given new tools to understand and interact with their child that promote more healthy communication and less disruptive behavior. And so we've offered that to the community as well. And that was in response certainly to some of the early childhood mental health services work that we've done in the county, that we hear from our referring partners that say, we would love to have something more for this age group, and that's something that we developed as a result. And again, it really does come down to connection and making the important connections both at the direct service level, connecting with that individual in the office, as well as connecting with the agency or the stakeholder that also values mental health treatment and understands how mental health treatment can enhance their services or what they do to provide services to the population that they're working with. And so we continually push forward in developing those partnerships. And certainly JSSA has been, I think, one of the more active agencies to seek out those partnerships. We certainly have increased our mental health service bandwidth to include, as Todd mentioned, care coordination and care management. So we do work with at-risk families through our Wraparound Montgomery program and help them address the multiple needs they may have across multiple life domains, and maintain the youth in the home and in the community where we know that they have better outcomes. If we were not working with these youth, they would typically then be transferred to a residential treatment center where they would then be sort of separated from their family, their community. They would receive treatment there. The challenge, of course, is that when they're returned home to their community, oftentimes the supports aren't there, the understanding isn't there, and the outcome of treatment, while it may have been positive for the youth, it does not always translate. In fact, it rarely ever translates into positive outcomes for the family. And so keeping a child and a family intact in their community is the absolute best practice and the best way to address mental health issues for a family, to help the child maintain themselves in their community. So those are a couple of the programs and the ways that we advance our connectedness to the community. And again, as Todd said, we struggle mightily with the idea that these things aren't always well funded. Certainly mental health, the stigma for mental health is not just in the community from those seeking it or thinking they need it, but also too in terms of insurance carriers and commercial insurance companies, and that think that mental health services are a nice add-on, but they're not essential. Studies are increasingly showing every day that our physical health and our physical well-being is very much tied to our mental health well-being, and that we absolutely ought to address mental health needs as much as we do physical health needs. And so we're hoping, of course, to keep working there and pushing that forward. But the challenge, of course, is that we provide these services, and it's in no small part thanks to the philanthropy and the fundraising that JSSA is able to do, that means quite a bit to the community. Certainly we have had a lot of folks be very grateful for the services and the connection that they receive through these programs and services. So I'll stop talking. That's a lot to say. I'm sure people would like to have time for questions, and happy to answer those, or however, if it's time to mute me. I know Todd's his finger's never far from the button to mute me when I'm going on and on. So, so I'll just wait here to hear if there are questions.
Great, thanks a lot, Joe. So a lot of information that we've shared. We really want to open it up and invite you to ask questions or comment, and have more of a dialogue over these next 15 minutes. So if you, I don't know if Matt has it, so you can unmute yourself, or you can also raise your hand like through the chat feature. I see you, Saul. You want to start?
Yeah, I have a question. Thank you very much, Joe, for that review of the program. Unless I missed this somehow, did you indicate any numbers of clients that we have in the mental health program, say this year compared to last year?
Yes, so we're actually working on pulling some of those numbers together for our year-end data analysis. What I can tell you is that we have increased the number of service units that we've provided. So the number of units of service have increased month over month this first quarter for July, August, and September by about 15%. So we have increased the number of sessions we provided from last year to this year by about 15% or so. We typically now are averaging about 2,200 hours of service per month. That's a significant amount higher than we did the previous year, which was at about, I think, 1,900 or so, around there, 1,900 or 2,000 or so. So we're quite a bit above that. In terms of numbers of individuals, we typically hover around 1,800 or so that are in active treatment. That's both for psychiatry and for behavioral health. We're struggling with some data difficulties with our new EHR to give you accurate year-over-year numbers, but we do expect that there's an increase in the number of individuals served, for sure.
Wow, that's a large number. That's really amazing. Thank you.
Yes, and I'll tell you, one of the reasons I think that we're able to increase the number of individuals served goes back to connection. We are located and we are partnered with agencies, stakeholders in the community that people feel comfortable with, that they can then guide them to access our services. And so it's much more effective to have that kind of relationship and really emphasize building that kind of programmatic element, because as we know, you can open your doors, to say, hey, we've got mental health services here. Nobody doesn't, nobody walks through, right? But when you have people that have connection to the individual needing service and can guide them to us, and there's a trusted relationship there, we see a much better result with regard to engagement and sustained engagement in service that leads to a better outcome. And I would say that, for example, our ability to partner with Leisure World, where we are serving senior adults. We have about 4 or 5 other senior living communities with whom we partner, and they are very helpful in guiding individuals to services, and it makes it very much more likely they'll engage and stay engaged to a successful outcome. So I would say there are increases very much largely due to that.
Yeah, even pre-pandemic, I think we were in over 60 different sites where we had our staff co-located in those sites. Schools, doctors' offices, senior living communities, synagogues, lots of different locations. And to Joe's point, it's a lot easier for, to be visiting your doctor and having a conversation, the doctor saying, why don't we go down the hall? It seems like there's something coming up. I'd like you to meet one of our colleagues over from JSSA, than to give somebody a sheet with a referral number and expect that that connection is going to be made. We just have found, as Joe said, that it is much more likely that people are going to connect and use the service if we are already co-located there. The pandemic obviously presents some challenges about being proximate in the same way, although, as Joe was talking about, some of the calls that we're getting from organizations are from new folks that we never would have been on site with, like Maryland Hillel, that says, we have kids who are on campus now, and they can't be in class in the same way, and they are really experiencing a high level of stress and anxiety, and the university counseling services cannot possibly accept and deal with all of the kind of referrals that they are getting. And so we formed a different relationship with them, that in this kind of telehealth environment, we can go beyond our usual geography and be able to serve people that don't need to be in such close proximity to us.
Exactly right.
Todd,
Yes.
you mentioned before the issue of the unpredictability of insurers being willing to pay continually. I know that Medicare tends to be a payer that whose policies are followed by private insurers. They look to Medicare as sort of the gold standard. How is Medicare responding to this as far as being willing to continue to pay for services delivered virtually?
Yeah, I mean, in the midst of this, they've been pretty flexible. They were a little slow on the trigger at the beginning, but they caught up pretty quickly. And right now, the regulation flexibility goes through the end of this calendar year, and we're waiting to see whether it will get extended beyond there. And their flexibility has allowed not just telehealth, but it's allowed for people who can't use the telehealth platform, it's allowed for us to do sessions by phone calls, which also has opened up the door to serve some people that otherwise would have fallen through the cracks for many providers. It's a little arcane, some of the rules, but I think it's important just to help you understand the distinction here, because there are some people who say, what are you talking about? Telehealth's been around for a long time. They've been pushing telehealth for quite a while. And that's true, but with a lot of limitations. And so telehealth's been around in rural areas where people can't get out to them and they've had to use it. But in more urban and suburban locations, it's been the exception rather than the rule. And even where it's been permissible, there have been a lot of concerns about how do we make sure that confidentiality is protected when we're moving to this video kind of mode of communicating. And so it seems counterintuitive, but the way telehealth was allowed to be delivered before was over video, but you still had to be in controlled office settings. So we had to be in an office, and the recipient of the service had to be in a controlled office setting so that there was an understanding that both of you were in confidential protected space. And so the real change, when we talk about change of flexibility here, was the ability to say the client can be in their house and our therapist can be in his or her house. And to be able to do telehealth in that way, and that really opened the door to allow for mental health services to be delivered much more broadly. And what you've noticed in this pandemic, when they look at how health services have been offered and received, is that, you know, if you look at kind of February and before versus March and beyond, the medical services being delivered have gone all the way down. They're a fraction of what they used to be. And telehealth is being used, but only to a modest degree. Mental health services, on the other hand, are being delivered at a higher level now with telehealth than they were before the pandemic started. You have more people getting service as a result of the telehealth and what their needs are during the pandemic than what you saw before. So the skeptic in me says, oh my goodness, they see a lot of money going out the door and they're going to get concerned and figure out how to pull the reins back on that. The optimist in me says they recognize that this has been critical to get services out to people who need it, who never would have been able to access it if they had forced office-based work. We'll see whether, you know, which shoulder, which optimist or skeptic plays out as we get closer to December. You know, I assume we'll see them kick this forward for another few months, but we'd love to see some of these changes made more permanent.
Thanks.
Sure.
Todd?
Yes.
I just wanted to just make a comment on the subject that you were just talking about. As you know, my wife is a therapist, and she hasn't been in her office since February. And she has now transitioned all of her clients to telehealth. And it's been very interesting because she thinks that the services that she's been able to render through the telehealth in many, many cases, and maybe the majority of them, are more effective with a telehealth program than she was doing in her office, because there is some element of focus that is just this person to person where you're on this screen and there's nothing else to get in the way of that connection that Joe was talking about. So it's surprising to me to hear that, you know, that we could go back and do it another way and get rid of something that has proven to be, you know, such an effective means of delivery. And then in connection with that, I just wanted to say to JSSA that, you know, Todd, I think you know that Kathy and my son have been receiving services from JSSA for probably, I don't know, 16 years now, maybe even a little bit more than that. And I just want to say to you guys that I think, you know, his experience with the transition to telehealth was instantaneous. And I feel like you guys didn't miss a beat, even though Joe said it took a while to get up in that platform. You know, that Jeremy's experience was that it was almost immediate, and it has been more than satisfactory. So I just want to, express a thank you to the way that you guys have instituted, your new platforms for delivery of services. I think it's just terrific, and really you are to be congratulated on how well you did with it.
Thank you, Joe. Joe and his team have done
Thank you.
absolutely outstanding job with that, and glad that it's having an impact for Jeremy. We want to continue to be there.
And just to add to your point, there's actually been studies done recently that show there is more of a connection in telehealth, or can be, and that you can communicate, in fact, more effectively empathy, because you are literally closer to the individual. I mean, when you think about seeing someone on the screen and all you see is their face, it's very different than them sitting across
Right.
from you in a room. And
Right.
so there have been studies done that show that, and Brene Brown's a wonderful researcher on empathy. And there's been this discussion that actually having that close to close, it's almost like you're less than 3 feet away from somebody, and that can really enhance treatment. So that's a really good observation.
We've had far fewer people stuck in traffic and missing their appointments, that's for sure.
That is absolutely right. Our cancellation rate has gone way down.
Todd, can I say something?
Yeah, of course.
I just want to thank you guys for doing this today, because I feel like I've learned so much, especially from everything you've been saying, Joe, and from what you said, Todd. And Mr. Mendelson, I loved hearing what you had to say about your son getting the help right away. Your programs sound great, especially the one for the younger kids that are out of control. I just think it is so needed. And my question was going to be, how do they know? But obviously you have so many connections from what I'm hearing, that you're helping so many families. And that's just so wonderful to hear, especially the way telehealth is going today. I really do hope that they keep telehealth the way it's going. I think it's probably better more for mental illness and for therapies than it is for a regular doctor. I think you get so much more out of it. So I just wanted to say thank you. I'm really glad I was on this call to hear this.
Appreciate you being here, Wendy, and thanks for your comments. Matt said somebody asked a question about how we expect, I think they were specific to Montgomery County, but in general, the fact that government and some of their grants and their contracts may be impacted by changes in the economic environment and tax revenue being down. We're certainly planning for that. I would say, the last several months was, kind of adjusting to the crisis and our new normal. And I'd say the last couple of months is figuring out how do we make sure that what we're doing can be sustained into, next summer and the year beyond, because for nonprofits, a crisis like this usually has a little bit of a delayed impact. And, to John's question, we experience some of the changes in funding from tax revenue being down, or from some donors not being able to give at the level that they could pre-economic slowdown. We experienced that maybe with a year lag and 2-year lag to it. The benefit on the mental health side is that a lot of our reimbursement for service is through health insurance plans. And we do get some money from government. It's not insignificant, but it also is not the lion's share of what supports mental health. So that certainly could have an impact on certain types of programs that we deliver. Montgomery County, for example, funds one of our therapists because we know that not everything is supported. So they give us money that basically extends our capacity. And that could be threatened, but that's one amongst 30 staff out there delivering services. I think the bigger impact that we are just starting to see or expecting to see is people losing health insurance and then needing to come for service and not having a means of payment in that way. And that is a whole other dimension of kind of how do you serve the uninsured or the underinsured that aren't really able to put services through their insurance because they either had to go to a really high deductible plan that they can't afford to put out of pocket, or they've lost insurance altogether. And I'd say it's still a little early in the crisis to be seeing the full impact of that yet. But we certainly have been having discussions. I think Joe and Kylie have a discussion with Montgomery County Public Schools tomorrow about us doing potentially more services through the school system. And that's one of their big questions to us is, how will you deal with all of these kids that we know are going to be uninsured? And are you able to meet their needs? How will you address that? So good question, John, about how economic environment and especially government support is going to have an impact. Right now, we're looking in the crystal ball, and I think we'll start to see more and more of the ramifications as the months pass. So I know we're right at 5:30. We want to honor the time that we asked you to take out of your day, and so we can stay on if some people have a couple of extra questions. But I do want to thank all of you who took the time to tune in and to see what JSSA was up to and to learn a little more about this particular issue. This is a group of very close friends and supporters of ours. And so nice to see so many of you that joined us and appreciate all that you do to help support what JSSA is doing. And I hope you take as much pride in what we're able to provide to the community as Joe does and I do and our board members do. So thank you very much for being here.
I think this was a terrific briefing. And I think I can speak for all of us. We are extraordinarily proud of this great organization and all the work that everyone does.
Thank you.
Thank you, Todd. This was very interesting and very helpful. I appreciate all your efforts.
Thanks, Rita.
Thanks, Todd. Thanks, Joe.
Thank you.
I think everybody is going to be getting a survey afterwards. Just, this is a little bit of a new format for us, trying to do some of these briefings. And so if you can give us a little feedback about it, what worked, what we could improve upon, I think that would also be a huge help as we figure out, how do we stay in touch with folks in this unusual environment that we're in and what's most meaningful.
Yeah, during